My name is Shelley Wright. This really happened at the Royal United Hospital, Bath, England, on the 13th of November 2017. This series of letters were part of my PTSD therapy to help process the events of that day and what has happened since. It shows that it's not just a traumatic event that is important, but how things are handled afterwards and how recovery may be impeded, especially when hospital staff cover up for their colleagues at the expense of the patient. Dear Mr. Nick Johnson, it is now just over a year since my cardiac arrest. Still no answers, no resolution, and continuing PTSD. You probably have heard from Tracy Miles that I am now a tired, miserable, and angry bag of bones weighing 54 kilograms, down from 95 kilograms on the day of my surgery. When you last saw me in May, I could see you were surprised at my weight loss, which was then down to 72 kilograms. As I have still not been able to properly have my say to everyone involved in this event, I have to resort to writing so no one can be left in any doubt as to the events and the effects that these have had. I wanted to start with the GP discharge letter of the 14th of November 2017 that you wrote. We spoke about this in May when you saw me outside of the complaints setup. One of the difficulties I've had in getting people to understand fully is that medical records have not been truthful or have not been written at all. The discharge letter that was sent to my GP was different to the one that I received. Why was this? As far as I am aware, what is sent to the GP should be sent to the patient, and I was not aware of this difference until I gained access to my medical records 2 weeks after the first complaints meeting. I was stunned to read it. Things were written that were not true. I told you this and you replied, it was a journalistic error. This is just not good enough. Medical records are supposed to be a true and accurate record. I asked you to amend my notes and you took a photo of the page and said you would. Did you? As yet, I do not know. In the letter you state, in the very short period of time she was waiting, she started to bleed again. It started just as they sent for her to come to surgery. She required significant resuscitation by experts in anaesthesia in the anaesthetic room, and then crashed her blood pressure with induction of anaesthesia. I'm not sure what your idea of a very short period of time is, but between B32 and the anaesthetic room, this is what happened, and it went on for over an hour. As you know, I had problems with bleeding and had been on tranexamic acid, which had worked well. When I thought I was about due to go to theatre, I went to the toilet. I suddenly started to bleed. It was a constant fast drip. I sat there very still hoping it would stop, but after a few minutes it had not, and I realised that I would soon be in trouble. I knew where the bleeding point was, and I knew it could only be reached by opening me up. Tranexamic acid earlier would have helped as well. There was a lot of blood in the toilet, on the floor, and on tissues in the bin. I walked slowly to the nurse's station and said, I am bleeding badly. There were at least 4 nurses, healthcare assistants there, but only staff nurse Moran came to my aid. It was not busy, they were sat doing paperwork, and there were only 3 patients left in the department. She gave me a large incontinence pad and put me in a room where I was not visible to any staff. As I am a really experienced nurse, I expected her to do a set of obs and immediately escalate me to the theatre team. Instead, she went off to clean the toilet. It took her 5 minutes to do this, lots of scrubbing and 3 flushes. How did she not realise with all that blood that she had the start of an emergency? I was terrified. I could feel the amount of blood. I didn't want to move in case I made things worse. I asked her to escalate me, but she did not and kept walking off. At the 3rd time of asking, I told her I was an A&E nurse and insisted that she escalate me. I could hear her talking, but I could not hear the content on the phone. She told me that I needed to be in theatre, but did nothing to get me there. From being escalated, theatre was ready at 11:40 a.m, but I still did not leave until 12:15 p.m. This is clearly written on my notes from B32, and that is not a very short period of time. I did not know it at the time, but Theatre 10 is just a few metres away, and anyone from B32 could have pushed me there, and likewise anyone from anaesthetics could have come to pick me up. The only reason I can think of that no one was in the slightest bit concerned was because staff nurse Moran had just told anaesthetics that I was all right and just anxious, but I insisted on the escalation. I still have not had any answers from anyone about this. I was so relieved when the porter came. I felt I would be safe when I got to the anaesthetic room and would be taken seriously. As I was pushed through the door, I said, "I am bleeding badly," but I was completely ignored and got up slowly onto the trolley, which was then covered in Inco sheets. Dr. Howells then started to put an epidural in. There were 3 other members of staff in the room who all ignored me too. I couldn't believe my colleagues were doing this to me. Why did they not take me seriously? I continued to be terrified. I knew what was going to happen to me. I could feel the amount of blood under me. I was thinking, there's no point in putting an epidural in when I'm exsanguinating in front of you. All the time the staff just exchanged glances with each other. No one touched me for comfort. No one said anything to relieve the terror. No one acted as my advocate. Dr. Story put an orange cannula into my right ACF, and Dr. Howell said, "There, you'll be happy now you've got that in." A litre of Hartmann's was attached. What's the point in that? Blood can only be replaced by blood, and clear fluids just dilute the circulating volume. There was no resuscitation, significant or otherwise, in the anaesthetic room. I was pushed into theatre with Dr. Howells on my left and the ODP de Cordova on my right. I was sat on a river of blood. I said to them, "Have you got the blood ready?" They just exchanged a glance right over me that said, "Anxious patient." It was awful. I knew that soon they'd have to act quickly. Why did no one listen? I was given fentanyl, and then an oxygen mask was put on my face. I sat up and said, "Guys, in case I never see you again, thanks for what you're about to do." Which part of that did no one understand? Have you ever heard a patient say that? From the timings on the anaesthetic room chart, I was in there for a further half hour, so that was over an hour since I had first alerted staff to my bleeding. No one had checked my blood loss in that whole time, and I had had nothing except for 500 mils of Hartmann's. You could clearly see the tranexamic acid and the blood was given after the arrest. My haemoglobin on the first ABG was 73. If I had had my blood loss checked and a haemoglobin done in the anaesthetic room, I would probably not have deteriorated. PEA cardiac arrests are preventable if identified in time. You can also clearly see on the blood transfusion labels that I was given 2 units over just half an hour. But this was also after the arrest and not in the anaesthetic room. This was also around the time that my operation started, so you would have seen this happening and you would have known that no resuscitation took place until after the arrest. Over a year later, I can still recall every second of the event, and still no one will answer my questions as to why they did not take me seriously. This just exacerbates the trauma. I could feel my nose was dry. I was trying to move something away from it. Someone said, "Keep the oxygen on. You had a cardiac arrest during intensive care." From that moment on, I was wide awake and vigilant. No one was ever going to harm me again. I touched my sternum, which felt bruised, and thought, that's what CPR feels like. You came to see me that evening. You looked really tired and said you lost a lot of blood. The next morning, Dr. Howells came to see me. As soon as she walked in the door, I said, "I told you I was bleeding badly." She said, "Yes, you did." It was a "yes, you did and you were right," not a "yes, you did, but you had not lost much blood and it was a propofol." She was pale and shaky and probably looked worse than I did. She said she'd spoken to you after I'd been escalated and realised that she should have got you to see me before she had anaesthetised me. If you knew I was bleeding and you had finished your previous operation, wouldn't it have been prudent to come and see me without prompting? Or had you all just decided that I was anxious and you didn't need to bother? You knew that I had had problems bleeding the previous day. For the rest of my stay, I just dozed and was constantly watchful. I saw on my discharge letter that I should have had a clinical nurse specialist visit me before I went home, but this did not happen. So after such a traumatic event, my partner and I went home with no support. The nightmares, flashbacks, disturbed sleep started straight away. I just lay there churning over the events. By the time I saw you at my 10-day follow-up, I was walking at least a mile a day. I needed to get fit so no one could harm me again. You said to me again, "Do you understand about the cardiac arrest? It was because you had become so dry." It was as if you wanted me to be in no doubt at all that the cardiac arrest was due to blood loss. Did you already think that people involved were not going to be candid? There was still no clinical nurse specialist input. Did no one at all think that after this event, and knowing that I was going to have to endure months of further treatment, that would have been prudent to offer me the chance or the choice of transferring my care? The Royal United Hospital is not a specialist unit, and there should have been no reason for me not to be able to complete my treatment elsewhere. There was plenty of time to transfer me, but no one gave it a thought. Why? Did no one think that after such a traumatic event, I would need psychological care? Mike Osborne was available and has an expertise in PTSD. I'm sure all the staff involved got support. Why on earth did no one think that a patient would need this too? I did not get a call from the CNS Tracy Miles until the 22nd of December, 5 weeks after the event. This whole episode just says to me that no one at the RUH cares about their patients at all. No one has shown me any advocacy at all. It is not every day that a patient has a cardiac arrest. Was that not enough reason to follow me up sooner? Did no one think of this, or was it supposed to be someone else's responsibility all the time? I saw Tracy Miles after Christmas. I was clearly displaying signs of PTSD and was discussing them with her. She did not get me referred. I already loathed every visit to the RUH. I felt unsafe and I trusted nobody. I had made an official complaint and was waiting for the meeting. I had been phoned by the Director of Nursing, Anna Gleghorn, who asked me to attend, as in her words, it's really powerful for those involved to see and hear how it felt. I had already asked to have my care transferred before further treatment began, but I was told it would be too difficult and would delay my treatment. I then had to endure 5 days a week for 5 weeks of treatment. Fortunately, the staff saw I was struggling. When I told them what had happened, they referred me to Mike Osborne before I'd left the department. It was as easy as that, and no one else before had bothered. I attended the first complaints meeting with my partner. We'd spent a long time putting questions together, bearing in mind that most of my trauma had been at the hands of an anaesthetist in an anaesthetic room. The meeting was held in the anaesthetic department. Who thought that one up? There was a large table in the middle with RUH staff up one side, my partner and me up the other. Not conducive to a trusting, welcoming event. I immediately realised that no one from the original event was there, just managers. The Director of Nursing had already been untruthful before we had started, and it set the tone for the whole meeting. I was unable to get the answers I wanted and needed because the people involved were not there, and no one else could answer. No one from the original event to this date has spoken to me, explained, or apologised. Although the nurses made a reasonable attempt at honesty, I knew from my nursing knowledge they were not being completely candid. Can you imagine how that felt, not just as a patient, but as a colleague? Malcolm Thornton was appalling. He was arrogant, dismissed everything I said, and was disrespectful to me as a patient and a colleague. I asked why Dr. Howells had not taken me seriously, as she knew I was an A&E nurse. He said, "Ugh, nurses and doctors make the worst patients." He said I'd not lost a lot of blood. I'd overestimated it and went to great lengths to tell me of a research project which showed people cannot estimate blood loss. He then told me my haemoglobin had been 99 at the arrest. This was just not true. I had been in RUH the day before and my haemoglobin was 92 then. He said the machines must be calibrated differently. I asked why I had had 4 units of blood if I had not bled badly. If I had had a haemoglobin of 99, I would not have required a transfusion. He then told me I had not had a cardiac arrest at all, just a drop in blood pressure, as I still had a rhythm showing on the ECG machine. If I had a rhythm and no pulse, that is the definition of a PEA cardiac arrest, and the most common cause is through blood loss. You were by then in the room. I said I have been told by Dr. Howells and Mr. Johnson that I had a cardiac arrest, and it is written on my chart there in large capital letters. He said he would get her to change her terminology. He told me that I'd needed the transfusion because I had bled during the operation. He turned to you to ask if that was correct, and you immediately said you'd had a clear field, meaning that I had not bled much during the operation. My recorded output from the swab count was 452 mils, which he circled. At last, I thought, someone is going to be truthful. I was waiting for you to continue and say what had really happened, but you just stopped. You could have sorted everything out there and then, but just as now, you stand silently with your colleagues. There was no point in continuing, as I knew I needed to see my medical records to prove the lies. I was completely stunned by the lack of honesty, not just by telling lies, but by lying by omission, which is just as bad. I then had my first meeting with Mike Osborne, 8 weeks after the event. When I explained what had happened, he said he'd never heard anyone recount a traumatic event so vividly, so long after it had happened. I asked why I'd been so affected. He said because of the delay in referral, it was preventable, my colleagues had done it to me, and there had been no resolution within the complaints system. It took 2 weeks to get to see my medical records, another unnecessary delay that just made me angrier. When I looked through the records, I was shocked, bearing in mind I'm a nurse of over 30 years' experience. Staff nurse Moran had written nothing about the entire event. How did she think that was all right? I looked at the front of the anaesthetic chart in complete disbelief. It no longer said PEA cardiac arrest in large capital letters, and A&E nurse was also no longer there. Who would tamper with medical records? I immediately alerted Jenny Evans, head of complaints, and Mark, the head of medical records, who were both in the room, and neither of them made any comment. I then realised that Dr. Howells had written nothing, either to say that I'd been escalated, that I told her I was bleeding badly when I arrived in the anaesthetic room. The pad I'd been sitting on had just been discarded. No mention of it, it had not been weighed, so the blood loss amount could not be proved. The notes just said, clots and blood in vagina. ICU notes say blood loss was estimated at 400 mils, and this is just not true. The dose of propofol for the induction has not been written in, but all of the other doses of the other drugs have been. The ABG taken immediately after the cardiac arrest showed my haemoglobin to be 73, and that was before the operation had started. I did not have a haemoglobin of 99 any time during my stay. Malcolm Thornton had just lied. If I had died in theatre, neither my family nor the coroner would have been any the wiser as to what had really happened. Who would have been honest and admitted how long I had been bleeding for? All the electronic notes were missing. If I had not been a nurse, I probably would have not known this and would have missed valuable evidence. I was then handed the transcript of the first meeting. It was littered with omissions and errors, at best appraisy and at worst untruthful. I was now even more wary and less trusting. It just felt like the whole of RUH was rotten to the core. I found out that after we had left the meeting, you had all had a discussion and amended what you had said. We had had no chance to discuss this, and it was cowardly and underhand to do it after we had gone. We sent back comments with all our corrections to complaints, who just replied, "Noted." I really struggled to get a second meeting and had to resort to writing to the CEO and to my MP. Still no resolution. The nurses had to admit the lies, as I had my paperwork. Absolutely no comment from the medics, except to admit the haemoglobin of 73. Then, as now, a complete wall of silence. I was just getting angrier all the time. I now felt even more unsafe. All I wanted to do was to get out of the place. I was now having serious anger issues on top of the disturbed nights and flashbacks. I was so angry and hurt by what my colleagues had done to me. I felt betrayed, everyone standing by silently watching me deteriorate. In May, Tracy Miles arranged for us to meet, as she knew I was still really distressed, and Mike Osborne was also present, when I saw you on D3, independent from the complaints department. I could see you were both surprised at my weight loss, then 72 kilograms down from 95 kilograms on the day of my operation. You said you were surprised that I'd stayed for the rest of my treatment. I said I had tried to leave twice, but my consultant would not allow it. You rolled your eyes to the ceiling and said, "No, she wouldn't, would she?" This just made my already hard journey even harder. You then said you were surprised that the complaint still had not been resolved, and your exact words were, "Everyone involved knows your cardiac arrest was due to your blood loss." At the time, you are telling me this and seem to really want me to know, but you will not stand up and speak up for me. I asked you to go to complaints department and put a stop to it. Did you do it? You are the one person in this whole event who appears to want to be truthful, but then you just stop short. Why? You have been to the debriefings, you told me, so you know what has been said and what the truth is, but you will not end my misery. Both you and Tracy Miles and Mike Osborne have watched me deteriorate both mentally and physically and have just stood there, and this I cannot understand. Why would you want such harm to befall a patient? Your duty to me did not end when you finished suturing my wound. I was told I would need a follow-up scan after treatment and went away for an extended break with my partner. Although we saw many wonderful things when we were away, the break did not have the desired effect. There was just too much time to think. My anger was now seriously out of control. Shouting, screaming, using foul language repeatedly, hitting things, trying to pick fights with much bigger people and doing stupid, risky things. The only way to keep this in check was to do more and more exercise. 2 weeks before our return, I contacted Tracy Miles to arrange the scan. Though this had been promised, it had not been done. We had already left Bristol with the intention of coming back just for the scan, and then I could transfer my care and finally get out of the RUH. As a result of this letdown, I had a major meltdown the next day. I dropped my partner at my in-laws and drove away. We are still apart 5 months later, and I am living in my camper van. Now I am still having to be in RUH every week to see Mike Osborne. I loathe every second in the RUH. No satisfaction from complaints. Everyone knows this is not about money. I loathe the compensation culture. It solves nothing. I just want a full night's sleep, not to be able to recall the whole event and not to be so angry. There is no joy or laughter anymore. I am unable to work in resus anymore. I have tried. I have no trust in an anaesthetist who I used to work closely with. Drawing up propofol makes me shaky. Hearing tranexamic acid mentioned makes me tearful. It is stressful even practicing CPR on courses. I can manage triage and minor injuries, but I'm just going through the motions. The event itself, at the hands of my colleagues, and my disgust at how the complaint has been dealt with, has destroyed my nursing soul. I will now do everything that I can to highlight this event, not just to get answers and peace for me, but to try to make sure this never happens to another patient in any trust. To highlight the plight of the patients who are just left on their own to pick up the pieces after a critical incident, the lack of honesty in the complaints procedure. All the staff involved had had debriefings, support from colleagues, managers, unions, occupational health. Why on earth would everyone think staff need support, but not the patient? Someone needs to take responsibility. I also want people to realise the consequences of their actions or their inactions do not end on the day. For you personally, sometimes you have to do what is right, not what is easy.